Thank you, Member. Caribou North.
Thank you very much, Mr. Speaker. Our communities, our families, and our province is currently being torn apart. We all need to commit to making mental health and supporting individuals with addictions a priority. I'm deeply concerned that the type of resources, the policies, and the direction that are currently being undertaken by this government to address mental health and addictions are just simply not meeting the needs in the province in areas such as Caribou North. Supports are becoming narrower in scope and failing to take on the perspective, the complexity of the problem in communities such as mine. The significant gap in resources in so many of our communities and the significant impacts of trauma. First, I feel there needs to be far more done on the preventative side. This includes an investment and significant ongoing campaigns with youth in our education system. We need to be investing in training and resourcing mental health support in our advanced education and post-secondary sectors that could include incentives to attract people to go into these important sectors. One of the ways could be looking at how to provide ways to forgive student loans if you come to an under-resourced area such as the North. I've talked to so many parents who've tried to access support for their children for mental health and support, and it just simply doesn't exist in our smaller rural communities. And the fact is, parents are waiting months and often have to go and travel long distances to get the adequate supports that they need, and we need to change this. We need to be investing in far more treatment options, recognizing that families deserve dignity and hope. I want to specifically talk about the need for increased residential treatment options. Currently, the reality, like so many of us who've talked to constituents, the reality is that individuals can wait months to get access to these critically important beds, and so often there is a significant financial barrier. I've talked to many families that have mortgaged their home and had to take on significant debt in order to support their loved one in treatment. This should not be the case in British Columbia today. Critical in these efforts of recovery is the need for housing that provides the greatest level for long-term success. I want to bring to this legislature the views and concerns of my community. When I talk to First Nation elders and our community members, it is critical that the resources we need to also include other substance addictions such as alcohol and crystal meth. In Caribou North, our First Nations elders and community members have been working hard for years to have access to detox beds locally. I want to thank everyone in the Caribou has worked so hard to make this a reality. I know this is an important project, and I will continue to raise it here in this House and ensure that they get the resources that are needed. We also have this incredible housing project put forward by the Quesnel-Tilikum Society. At the request of government, the Society invested significant funds to develop a proposal, work with architects, and get through the approval stages of our local government. It is a worthy and important project in our community, and I hope that this government will recognize that the urgent need for housing reaches beyond the Lower Mainland and into our small rural communities as well. This is a project that I know the government can be proud of and would have significant impact in our community in addressing mental health and addictions. I believe that we need to be providing far more training in medical school and other healthcare training programs in the support of treatment for both mental health and addictions. Further, we need to recognize the important role that physicians, nurses, and other healthcare specialists provide in the support of people. You cannot go in with a mental health challenge and expect a 10-minute appointment with a physician to be addressed. We need to be looking at how we change the system. We need to ensure that our healthcare systems, our institutions are better designed to include and address mental health and addictions as we continue for the full continuum of care. At the end of the day, it's clear we must do more, we can do more, and I challenge everyone to accept that challenge.